Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Alexis Sanderson, and Alexis has spastic quadriplegic cerebral palsy, and she can walk with two hands held pretty well, trunk support pretty well. In a walker, she needs help to steer, because of her cerebral palsy, she has poor foot alignment. So her foot really wants to roll in, and then she wants to end up crouching. So I'm going to go ahead and stand her up so you can see. You can stay focused on her feet. You can see how her feet really roll in. So she needs support, and the trick is to figure out what support is the best support for her feet. Alexis, can you bring up and down your foot like that? Up and down. Up and down, up, and down. Touch that floor down there, Pull your foot up, and down, down. So she has foot movement that she can do. So I'm not crazy, there, see, up and down. I'm not crazy about putting her in a solid AFO that has no foot movement whatsoever. That would be what would be the most supportive of her foot, but she has functioning in her feet, and if you block completely in a solid AFO her movement of her leg completely, that's going to discourage muscle growth and muscle strength. So I like, for a child similar to Alexis, is to have a brace that, for a while we used one that had a dorsiflexion assist that helped clear her foot when she was walking, but had a hinge. These that she has now are cascades, and they don't, so a dorsiflexion assist would pop that foot up into dorsiflexion. This one just has a free ankle on it that allows her foot to move freely. She can, ones that are solid like that make it difficult for her to crawl. This one allows her to point her toes when she's crawling and allows her to move for transitions. The negative side of this is that over time as she walks, she tends to crouch and sink down. And this has nothing that discourages her from crouching. So for right now, what she's using is a flexible joint that has no dorsiflexion assist or plantar flexion block. So it doesn't encourage her foot to come up, but it doesn't block her from pointing her toes down. All right, let's put these on. I really like this height chair for her for putting on the orthotics, because she is able to have her feet on the ground, so she can stabilize herself to be able to lift up a foot, to be able to put the foot into the shoe or the foot into the brace, and then to be able to press down through her foot to be able to get the splint all the way into the shoe. You saw right there that she was tapping her foot with her left foot. If she had on solid orthotics, she would not have that free movement of her foot to be able to tap it. One of the things I do like about these braces is they have the low shin strap that helps make sure her foot stays well back in the orthotics. I think one of the things that we're considering for her is maybe having a set of ground reaction braces, there goes that tap, that when she starts to fatigue, that they can pop off the shoe and slap that on the front of them to be able to block her from crouching so much when she walks. Because when she gets fatigued, she does crouch a good bit. Alexis, can you sit up like a big girl for me, please? Thank you. So I think that there are a lot of pros and cons as you think about the correct orthotics for Alexis. There's not really a perfect one. The perfect answer would be to have her muscles react the correct way. These are ones that allow her to crawl, allow her to move her feet, but again, allow her to crouch. And I think a combination of the two, of having something that she can add on when she's crouching too much, but having free ankles the rest of the time. You need to sit up like a big girl. You need to sit up like a big girl. Thank you. I hope this is helpful, and we'll look forward to seeing you next time. Alexis, can you tell them bye? Bye-bye. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.